CHS Group Orientation, Module 1, Section 4, Other Considerations. Limited English Proficiency. LEP refers to a person who does not speak or understand English fluently, as it is not their primary language. If an LEP client cannot receive services in their native language when necessary, the federal government views that as discrimination on the basis of natural origin. This would violate the Civil Rights Act of 1964. The county is responsible for identifying and paying for interpretive services for those people who have been identified as people needing interpretive services. Medicaid Integrity Training. All services our clients receive from us and from most other stakeholders are paid for by Medicaid. CHS, as well as other providers, signed a contract with the local county health organization which outlines what they want us to do, how they want us to do it, and they identify all the rules Medicaid requires. Here are just some of the Medicaid rules. Keep health and all other information about our clients private. Do not share a diagnosis, health issues, or personal information. Do not leave medical or health information lying around for others to read. Store health and medical information in a way that no one but the people who need to know can get to it. Clients have a right to their own health and other information. Clients have a right to be aware of available services. And clients have a right to file a grievance if they're dissatisfied with care. If you see CHS administration or any other provider breaking Medicaid laws, they can't retaliate against you if you report the problem. CHS and its representatives must cooperate with the county's efforts to prevent fraud, abuse, and waste of Medicaid dollars. Documentation, including timesheets, progress notes, data sheets, and logs, must be completed accurately. It is Medicaid fraud to falsify this information. The client's plan of service is developed by case managers and must be understood and followed by all staff members. If you have questions about the plan of service, please see your supervisor. Staff are expected to teach, assist, and prompt the client on the goals identified in the plan of service. Staff should not complete the client's goals for them. As the provider, we need to challenge them as much as we can within the guidelines of the plan of service. Fraud examples include billing for services not performed, billing duplicate times for one service, billing for a more costly service than performed, accepting kickbacks for patient referrals, or billing for a covered service when a non-covered service was provided. Medicaid abuse and waste. Abuse means provider practices that are inconsistent with sound fiscal, business, or medical practices and result in unnecessary costs to the Medicaid program. For example, services that fail to meet professionally recognized standards of care. Waste means overutilization of services or practices that result in unnecessary costs. Waste also refers to useless consumption of expenditure without adequate return, for example, providing services that are not medically or clinically necessary. Some of the issues that are more relevant to you as a CLS staff is making sure that the documentation is legible. Make sure that there are signatures where signatures are required. Make sure that there's no mismatch between the services that are given and the services that are identified in the treatment plan. Make sure you have the right date, the right person, and a clearly defined service. Make sure there is no missing documentation. Make sure that there's no missing start or stop time. Make sure that there are progress notes for all services that are billed. The person-centered plan. Each client has a person-centered plan created by their case manager with input from the client and other stakeholders, including the guardian, the provider, the psychologist, and you. The person-centered process helps to identify desired personal outcomes based on the individual's life goals, interests, strengths, abilities, desires, and preferences. The process helps to determine the supports and services that the individual needs to work towards and achieve these outcomes, and accordingly develops a plan that directs the provision of these supports. This includes habilitation needs, healthcare needs, behavioral challenges, and strategies to help address these concerns. A person-centered plan is updated when an individual wants to make changes or when a goal or aspiration is achieved. In simple terms, person-centered planning is a method of forming life plans that are centered on the individual for who they are built and meet the person at where they are at various times in their life. Person-centered thinking challenges us to actively listen to the people we serve and to those who know them best in order to understand what they want for their lives. The PCP meeting. Generally, a PCP meeting is held once every 365 days. This is a Medicaid rule. Therefore, a new document is also generated each year. Medicaid pays for the majority of services a client receives. The client has to be at the meeting, and the supports coordinator runs the meeting. Caregivers, staff, and families are encouraged to attend as well. Topics for the meeting typically include how the person did on achieving their goals from the previous year, what their new goals are, whether or not there are any problems that should be addressed, and what successes the person has experienced. Why is the PCP important? Think of the plan as formal instructions about how to interact with each client. All the rules, exceptions, procedures, goals, and special information are located within this data. If staff don't bother to read or make an effort to understand the information, the client could get hurt. Also, not running goals properly could be a reason for disciplinary action or a substantiated rights complaint. Staff should review the PCP as often as possible and always before they begin working with a client so they will be knowledgeable in the correct way to interact with them. If the PCP or IPOS doesn't have enough information, staff should notify their supervisor so the supports coordinator can amend the document to include more information. Remember, the PCP is an important document because it allows people to grow and develop, it allows people to gain control of their environment, it is the law, and it is required behavior as mandated through CARF and our funding source.